When taking L-Carnitine, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. It's best to take L-Carnitine with or just after meals to lessen stomach upset. If you are taking more than one dose a day, take the doses at evenly spaced times throughout the day. If you are taking the liquid form, use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon. The liquid form may be taken alone or mixed in a drink or other liquid food. To prevent stomach upset, drink your dose slowly or mix the liquid form with more fluids or liquid food. Chewable forms of this medication should be chewed thoroughly before swallowing. The dosage is based on your medical condition and response to therapy. Do not increase your dose or take this medication more often than recommended by your doctor or the package instructions without your doctor's approval. Take this medication regularly at the same time each day to get the most benefit from it. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of L-Carnitine may include upset stomach, nausea, vomiting, diarrhea, headache, muscle pain/weakness, swelling of hands/lower legs/feet, tingling skin, or body odor. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it means that they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any very serious side effects, such as seizures or a serious allergic reaction. Signs of a serious allergic reaction may include rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's essential to note that this is not a complete list of all possible side effects, so if you notice any other effects not listed, it's best to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report any side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Before starting L-Carnitine, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, discuss your medical history, especially if you have kidney disease or seizures. If you are using the liquid form of L-Carnitine, be aware that it may contain sugar and/or alcohol, so use caution if you have diabetes, alcohol dependence, or liver disease. It's important to talk to your doctor or pharmacist about using this product safely. If you are pregnant, only use this medication if it is absolutely necessary, and discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. As for the daily dosage and optimal timing, it's best to follow the instructions provided by your doctor or pharmacist, as they will consider your specific needs and medical condition. Always take L-Carnitine as directed and do not exceed the recommended dosage. When taking L-Carnitine, it is important to be aware of potential drug interactions. These interactions could affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. This will help ensure that you are taking L-Carnitine safely and effectively. If you or someone you know has taken too much L-Carnitine and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. If your doctor has prescribed L-Carnitine, it's important not to share it with others. Always check with your doctor or pharmacist before changing brands or dosage forms of L-Carnitine. Different products may not have the same effects. While taking L-Carnitine, you may need to have lab and/or medical tests such as blood chemistries, vital signs, and serum carnitine levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of L-Carnitine, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Don't take double the dose to make up for it. It's best to stick to your regular dosing schedule. When it comes to storing L-Carnitine, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and be sure not to freeze the liquid form. Always keep medications out of reach of children and pets. When it comes time to dispose of L-Carnitine, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. It's a good idea to consult with your pharmacist or a local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.